Welcome back to Open BXRx. COVID-19 has had a disproportionate impact on low-income communities in the South Bronx, and Mott Haven community members have been advocating for the needs of the seniors, children, and families who have been impacted by this pandemic. Joining us now are two of these advocates, Ramona Ferreyra, social entrepreneur and founder of Ojala, and Althea Stevens, Department Director of Community Affairs at Eastside House Settlement. Hello, ladies, and thank you for joining us today. One of the first things I wanted to discuss with you both is just about the needs of Mott Haven and how you're each advocating for a community. Can we start with you, Althea?
I am the department director at Eastside House, and so my job is really to be the ground, on the ground, doing community affairs and trying to seeing and assessing the needs of the community. So we have been doing food giveaways at all three of our community centers 2 to 3 times a week. Also at the request of families. We serve over 466 families in the Mott Haven section of the Bronx. And so we've been doing a lot of outreach to those families to see what their needs are and connecting them to services in addition to anyone else who's in need. So we are not just limited to our people who are participating in our programs. We're also trying to expand that thread of whoever's in need. How can we help? How can we be of service?
And Ramona, can you also tell us about the outreach that you do and the advocating that you do over at Mott Haven?
I normally do work focused on criminal justice reform, public transportation, and public housing. Since COVID began, I've begun to focus on public housing because of the pre-existing conditions within NYCHA. When NYCHA first saw the COVID situation in the city, they started using modern means to communicate with folks. So they were using texting, phone calls, social media, so Instagram, Facebook, and Twitter. And in this community, the majority of people have very low connectivity, including myself. I didn't have internet in my house until Optimum started offering the 2 free months. Up to that point, I depended either on the public library or hotspots that I would connect to for free, including like the NYC kiosk. We also know that a lot of the people that are in this community, their phones happen to be Obama phones. So they change their numbers regularly. They don't move their number or change their number in the office. So we don't know who really NYCHA was reaching. And they don't normally have email. So while NYCHA saw an increase in how many people were using the app, we know that 400,000 are not. So that means that a huge population of residents missed out on critical information in the beginning. Did you want to add something, Althea?
Yeah, no, I just wanted to interject because I think that it's important that we highlight the parallels between what's going on in NYCHA and then talking about what's going on in education, right? Because we're talking about how NYCHA transitioned to this virtual world and kind of reaching residents that way. But the same thing is happening in our school system right now. Because of COVID-19, the response was, we're just going to do virtual learning. So we had all these students saying that we're going to transition to virtual learning. And then when you talk to, or when you hear at these press briefings, the mayor and the chancellor are talking about how virtual learning is going so well. But from a lot of the wellness calls and the outreach that we've been doing, there's a lot of students who don't have access to all the things that you just talked about, Ramona, right?
Yeah.
So we found students who didn't have laptops or tablets, or if there were, they would have their families who have 4 and 5 children and they have 1 laptop and all the kids are expected to use that. Then we found out that there were a lot of students who are in shelters who don't have access to Wi-Fi at all. So even with our efforts to try to get them tablets and laptops and things like that, they're like, well, we still can't use the Wi-Fi because the shelter won't give us access.
Right. Can we lead into your community efforts respectively? For both you, Ramona, and you, Althea, you're both leading these efforts in the Mott Haven community to get this technology and this access, these resources to both seniors and children and families. Can you both just tell me about that work that you've been doing?
One thing that became critically important for the seniors is that while they are isolating themselves, a lot of them still depend on homemates coming in. And homemades are not being equipped with safety devices from masks, gloves by their companies. And for those that do have the means to purchase them, you can't find them anymore locally.
Yep.
And the delivery times are so lagged behind that we have cases of seniors that were infected by their homemates And now we're thinking that the ones that have died because of that. So we started looking through social media, bringing attention and asking people that had been fundraising and getting masks for medical personnel to start donating excess to us, because now we know that medical personnel is being properly equipped, at least in certain communities.
Why are home aides not looked at as medical personnel? Like they
because
are
they're
like
seen as disposable.
Right. That's what I'm saying. Like, I think that that's like insane.
This brings up the point that you were making, like in the conversations that I've started to have now. Yes, we're looking for you to donate masks, but at the same time, what I said was, I'll take a mask now, but long term, what we need to be looking at is how do we get them reusable masks? Because I cannot give them a single use. I need each senior and each resident at Mitchell houses, because most of the people here are still having to go outside. So how do I get them each a reusable mask so that they can wash one when they get home and have an alternate one for use? And then even further down the line, going back to what Althea raised, is the city needs to start coming up with a response plan that isn't a one size fits all. So my background in disaster response, the first step that you're supposed to take is assess where the community was before you respond. And I think that the failure we're seeing in the South Bronx and in places like Queens is that when the city started giving instructions, they were giving instructions and decimating those instructions in a way that makes you assume that we were all starting on the same level.
Right.
And we were not, right? So our community.
But that's how they always operated, right?
And I think this goes to even a longer conversation of what does the city look like 2 years, 5 years, 10 years from now? And that equity that we need to start talking about is making sure that when the first testing sites are put up, they're put up in the community where we have the highest rates of asthma.
The bulk of the deaths are concentrated in the South Bronx, but all of the testing sites are in the North Bronx, and there are at sites that are not accessible by public transportation.
Yep.
So then how are people supposed to get there? So for me, I think it's exactly what you're saying. And to add to your point around, we're talking about what does equity look like in the long term? Like, I think we've been able to kind of push things under the rug because we didn't have this pandemic. But for me, COVID-19 is only shedding light on things that's been going on for way too long. So
we've been yelling about these things for a very long time.
We have.
Yelling about, the fact that seniors needed access to a home that didn't have a leak. Because I'm still getting leaks in grandma's apartment. We don't have hot water today. Our elevators are still breaking down.
Yeah, they still don't work.
These articles are being put out stating, Bronxites are twice as likely to die from this pandemic, from COVID-19. So now, what are the socioeconomic? What are the issues that are affecting us in the South Bronx that need to be rectified in order to avoid this, right? And the work that you're doing is super important, but it's also something that you've been doing even before this.
Every single one of my elected officials has been extremely quiet through all of this when it comes to what's happening in my community. It has been mutual aid networks that have come together. So La Morada just called me and said, hey, we are joining the World Chef's Kitchen. We want to come to Mitchell. The instructions that they're getting from the kitchen is you deliver the food to people that cannot leave their homes. So that's something that I know is needed by at least 300 people at Mitchell houses.
No, absolutely. Because through our calls, it's interesting. I got an email from a school official the other day because they hear we were giving food out at the community centers. And they're like, listen, like, this is a real story. We have a mother. She was in the hospital. She was diagnosed with COVID. She has 2 small children. Mm-hmm. She can't leave the house. The kids are in another room. She can't go out shopping. They need food. And so for me, I'm like, well, we don't do deliveries, but she's like, where is the service? Who can I get help? So I've been like hitting people up, trying to find ways to get them food. But it is so true. Like, that is something that's not being talked about.
Even in this crisis, when people from the outside come, if they don't connect with the people that have been working in the community, that can tell you where the need is and how the need needs to be fulfilled and how it needs to be communicated to the community, the need's not going to get filled.
if there's one instance going on, then that means it's going on at a bigger level.
That's just one you know about.
It's not isolated, right? So for me, this is just one story of, I'm sure, of 100 other families who have sick parents, who have elderly people, and they can't leave their house. And so how are we servicing those needs? So it's those things where it's like, what are the solutions? And I think I want to bring something up that Ramona had said earlier, where it was like, where is the assessment of like the community needs, right?
It hasn't been done.
Right, exactly, right? We know that the Bronx has higher asthma rates, higher obesity rates. This is not a secret. No one, like, no one can say like, oh, we didn't know, like we had no idea. This is not a secret. So for me, how did the state and city government sit back and say, well, let's look at these numbers and really see how do we serve these communities, because the disparities are going to be there.
And then the mayor's first response to the report saying that it's Blacks and Latinos that are dying and that they're dying in the Bronx was, we need to start a new ad campaign. And I'm like, my man, you have been showing New York City Department of Health ads every single day. And if you've been doing that every single day since this began and you're not seeing a change, then you need to reevaluate if that is the correct way to reach the people that you are not reaching.
But let's also talk about how the bulk of the essential workers actually live in the Bronx, right? So these are the people that are actually out there in the front lines, right? These are our cashiers at the supermarkets. These are our home health aides. These are our bus drivers. These are our train workers. And these are the people who are out there still to this day on the front line. So it's like, okay, we need to make sure that they have additional services, right? We should have gotten double testing sites. We should have gotten more services, more food distributing. Like, I mean, the fact that we have tenant association presidents in the NYCHA residents, they've been the one giving out the food. You know, I want to give a shout out to them. Like, we have resident association presidents that have been out there 6 days a week giving out food. Like, Danny Barber literally unloads that truck over there on Morris, and he actually has a U-Haul and delivers it to the different developments in the Bronx since it started. So it's like, where's his relief coming in? Who's going to come in and take over for that for him? Like, we have people on the front lines, and God forbid he gets sick. Now what? What's the plan? And for me, I have not heard a plan about like, what's next? How do we support each other and what this really looks like?
Glad to have both of you ladies here, because community-led efforts is where all of this is coming from. This help and, you know, disseminating this information to folks who need it the most. I just wanted to touch upon, Althea, the distribution of the laptops and how you were able to identify with East Side House Settlement, the 30 students in the Mott Haven school that needed this tech ASAP.
Like I said, we service about 466 elementary school students in the Mott Haven section. East Side House has a host of programs, but those are the ones that's in my department and my portfolio. And so from our wellness calls and reaching out to families, there was about 30 students who either had multiple children and only had one device, or they had nothing at all. So we found that the bulk of our students who were in shelters or in transitional housing didn't have anything. And then we also found other students who there were like 3 or 4 kids in the house and they had one device. And so especially with the Google Hangouts and with the way the teachers are doing it, they have very specific times they're on and then they're off, and that's it. So it's been very difficult. So it's funny, me and Ramona were having one of our sessions where I was like just kind of telling her, and then she was the one who actually, I won't lie, who started to ring the alarms in the community around like, hey, we got these kids, let's get this done. And so I had already reached out to folks, and Eastside House was working with some of our foundations and our board members who also was on the ground trying to figure these things out. And so as of right now, we were able to find Eastside House between the board and our getting some funding from some other places. We're able to buy. We actually bought and actually got donated about 20 tablets. We're still working with some other community partners to get the last 10, but even the 20 is going to be a big relief. But like I was telling a couple of folks before, our kids in the shelters, we spoke to the parents, we reached out to them, was like, hey, we got the tablets, we can start picking them up. And they were like, but we don't have Wi-Fi, so what are we going to do with them? So it's just like, I feel like you solve one problem and then it's like the next layer. Because I was like, with this free spectrum and da-da-da, they were like, well, in the shelter, you don't have access to those things the same way you would in your apartment. So now I'm trying to get a list of those who are in the shelter who are having trouble getting access to Wi-Fi. And then I'm bringing those to the elected officials, like, these shelters are in your district and I really need you to figure out how to get Wi-Fi capability to all these children who are in the shelter.
What we need to understand as a community is that the things that Althea and I are bringing up are not things that are new.
Right.
What we need to look at is, who are we putting in office? How long are they there? And what tangible deliveries are they making to our community? Because there's no reason in 2020 why any child in New York City should be staying in a shelter or transitional housing and not be able to get online. How are they supposed to handle transitional housing, insecurity of home, insecurity of food, the trauma of not having stable housing, constantly having to change and deal with change, and on top of that, not being able to perform with the same tools as their peers? How do we have millions of dollars invested in looking at what helps someone cope and succeed, and no one in the city has thought every single family shelter should be equipped with internet?
And having access to computers, right? Like, I know some of them have like computer labs, but at this day and age, you don't have like a laptop cart where kids can like check things in and out. Like, right. So I think that those are those things where no one ever even thought about.
Thank you for your time. I got to wrap us up because of the time. I wish we had more time to discuss all of these important and pertinent issues, but we at BronxNet are definitely following up with all organizations, community members just like you, and leaders who are doing their part during this pandemic. So we'll definitely be talking about these other issues soon come. Thank you.
Stay mad.
Have a good one.
And to keep up to date with Althea and Ramona, you can follow at Althea_Stevens_D16 and follow Ramona the Mona to keep up to date with these community leaders and their efforts for Mott Haven during COVID-19. Open BXRx will be right back.